Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Aiden Feng. He's a physician executive. Today's Kevin MD article is Rising ER Wait Times Signal Larger Health System Challenges. Aiden, welcome to the show.
Thank you so much, Kevin. Thanks for having me. Great to meet you.
All right, so tell us what led you to write and submit this article on Kevin MD.
Yeah, I think it's about exposing some of the paradoxes we're seeing in healthcare, and specifically, what motivated me was an issue that extends far beyond the emergency department, but it's manifested in the ER specifically, and that is, in all other industries, with the implementation of technology, there's usually exponential growth in productivity and capacity creation and experience improvements for both workers and customers, in our case, patients. But what's surprising for to us has been billions of dollars have been invested into EHRs, all these digital health solutions.
Yeah.
And the result is interesting. It's that, I think in the article I mentioned in terms of productivity and wait times in the emergency departments. And despite technology investment, we've actually become less productive in healthcare. And that was the core question in my mind as we did a deeper dive into this arena, and specifically in the emergency department.
All right, so tell us a little bit more about how that influx of technology actually makes us less productive, certainly in the emergency department setting. So give us more detail.
Yeah, I think there are many compounding variables, right? This is not just if I remember my statistics class. This is not, it's a multi-variable regression, not just direct cause and effect. And I think, with COVID, volume, ER volume, hospital volume dropped, and then obviously staffing went down. And as we've returned back to normal, volumes have increased, and then there's been a lot of staffing shortages. That's one component. But in terms of the technology component, I think what we have seen in the market has been there's a disconnect between how technology is deployed, right? There is the source of truth, the foundational layer of
Yeah.
the EMR, that's optimized for record keeping, optimized for billing, and then that's a single source of truth. But the layer on top of that, the to automate workflows, to curate patient experiences and journeys, that is a very fragmented ecosystem
Yeah.
full of dead ends. And a lot of the health systems that we go around and speak to and partner together with, they have deployed 5 to 7 to 10 of those, and they work very hard to, each of them have to integrate into the EHR to pull and push data, but they work to cobble them together to create one experience. But that is very, very hard because there are conflicting incentives. And what the result is that there are a lot of dead ends for
Yeah.
patients, for providers, so on. And then there's a lot of soul sharing between different systems. And I think that is one of the core causes of this manifestation we just talked about earlier.
So give us a case study just so we can see it both from the clinician standpoint and the patient standpoint. Tell us some of these cobbled together technology solution that lead to these dead ends. Let's say from a physician standpoint, what would exactly that look like?
Yeah, for sure. I'll just give you one quick example, right? If you go to some of these health system websites and you say, I have pink eye, there are three scenarios that could happen. One, I do not understand what you wrote. Can you please say that again,
Uh-huh.
or call this number? And then,
Sure.
again, introducing burden. Two, here's a link to our ophthalmologist.
Okay.
And that is an ophthalmologist's worst nightmare, right? To get a healthy pink eye patient in their clinic slot.
Yeah.
Three, it actually understands your intent, and then and then guides you to a virtual, urgent care visit, or that can be just happen immediately, right? So that's just one quick example. The first two scenarios introduces more complexity into the system rather than less. And then all of a sudden you're either at a dead end or you're on a wild goose chase that takes, someone on the phone or a triage nurse in the clinic to redirect you, right? That's one example. Another is, some of these physician or provider focused automation tools. you know, I don't know about you, but every time I'm documenting, I hate having to click even one extra button that I don't have to,
Yep.
or opening a separate window. And again, that just introduces more complexity, not less. And there are probably thousands of digital health companies out there nowadays that do not think about how they fit within your workflow
Yeah.
on a day-to-day basis.
Yeah. So I think that healthcare is, of course, one of those fields where paradoxically, when you add technology, it adds complexity, right? And you mentioned the electronic medical records. Like, I'm a primary care doctor. So that's one of the fields where, since the introduction of the electronic medical records, it created a whole new field of scribes, right? To translate what we say in the exam room and put it in the electronic medical record system. And now with the advent of AI, you just have that another layer where you have these AI scribes now can listen to us just so we can put the note, so we can put that note in the electronic medical record. So it really illustrates how more technology actually adds to the complexity and paradoxically sometimes can make us less efficient.
Yeah, that's true. So, but I think that's a very broad statement, right? It goes to what I said and what you said. But I do think that there is a lot of potential. I don't want, we shouldn't be discouraged, right? And that's actually why I still work in the technology space, right? And
Yeah.
that is because if we are, grounded on what it's actually like in the clinic, in the hospital, in the ER, and put physician or nurse or APP workflows at the forefront, and then design technology around that. We should always take a patient and care first approach. I go around and I just got back from Vive, and I heard many people saying, "Oh, hey, Epic first this," or Oracle first that. I mean, I'm like, oh, I mean, shouldn't it be care first or
Mm.
patient first,
Sure.
or even provider first in terms of we need to fit technology into care, not the other way around, right? And so I think that's point number one. Point number two is the integration of these or consolidation of so many of these point solutions
Yeah.
into one single platform. And then number three, to what you were saying just now, is there are some really impressive technology out there with the large language models and the newest AI technology. But we need to really be thoughtful about how we apply that and how it fits into uh, our care workflows today.
So specific to the emergency department, which is what your article was talking about, tell us about your vision to overcome some of the obstacles that you're describing.
Well, actually, I didn't even talk about what I do. So, so I'm still, I'm a practicing anesthesiologist, but also, as you can tell, care a lot about, digital health and
Sure.
the application of technology in healthcare. So the reason it's been a learning journey, I work at a company called Fabric, and it's been a learning experience over the past, 4 to 5 years. As much as, I say, oh, hey, there's too many point solutions and we need that integrated platform. We actually started as a point solution in the emergency department.
Right.
So to answer your question, over time, we started as a The patient walks in the front door of the emergency department. We text the patient, set expectations, make sure they know what's happening, what to expect, and then automate some of the data collection, right?
Yeah.
You broke your right pinky, but I have to ask you about, nurses, the nursing staff have to
Sure.
ask you about everything from suicidal ideation to social determinants of health, so on and so forth, automate some of that. But what we quickly realized was the ideal ER experience for patients is actually to not be in the ER,
Hmm.
right? So I
Yes.
think that is where we need to start in the ideal scenario. It's the lay consumer, they're sitting on the couch and they are trying to figure out what to do, where to go, who to talk to. So how can we, deploy technology in a way that reaches them at the top of the funnel,
Yeah.
hold their hand through the journey of getting the right care at the right place via the right modality with the right provider. I think that is the opportunity, right? If it's a uncomplicated UTI in, a young woman, then you can literally just do an asynchronous virtual visit and be done with it in 10, 15 minutes and you get a prescription in your box.
Yeah.
But, for if you do need to go to the ER, let's navigate you to the emergency department. And once you're there, right, to what I was talking about earlier, setting expectations, but also leverage technology to create virtual journeys in the ER. And what I mean by that could be, you know, centralized virtual nurse triage or
Mhm.
virtual pitch provider in triage to kick off the workflows, right? Instead of, waiting there. And then all of a sudden you're free, you have a centralized team of nurses and providers that can cover multiple ERs, multiple inpatient floors if needed. And then you're freeing up resources on the ground to draw blood, to administer medications, and so on, to move things along. And then you can even take that one step further to say, we can actually create a whole virtual fast track of low acuity chief complaints. You come in and you get virtual nurse triage, virtual provider. They can actually just write the note and then and off you go, right? And we can talk about all the regulatory requirements in terms of EMTALA and whether virtual exam counts as a medical screening exam and all those things. But based on our experience, you can definitely work through that and still bill for that visit and create a curated experience that is specific to your needs and your acuity level.
Sure.
And let's not forget on the back end, before you leave, let's make sure you get attached to a PCP and you have a follow-up appointment scheduled. What boggles my mind is, every time you get your teeth cleaned, before they take the bib off, they're like, hey, let's take a look at the calendar. When do you want to come back for
Yeah.
your
Of
next
course.
cleaning? 6 months from now, right? Like we can automate a lot of that, right? Before you even leave the ER. And, instead of giving you the paper, let's give it to you via text and digitally, and then check in with you virtually, through our automated messaging after you leave the next day, 3 days later. That is kind of a consumer or patient first journey that, I think that, we should be powering and moving toward. And then the consequence of that on the provider side and then on the nurse side is that like actually and the hospital side, it actually frees up capacity, right, on the ground. And now you can actually spend time focusing on the sickest patients and so on. So that's how we're thinking about it.
So patients with low acuity complaints will be seen by a virtual triage and if handled and if appropriate can be managed and treated virtually without that patient setting foot into a physical emergency department. Is that what I'm hearing?
Well, that'd be ideal, but sometimes you need to go in person to get labs and get medications and so on. Maybe and you know outside of the four walls of the ER, we need to create, you know, accurate triage mechanisms to send people in that actually need to go in.
Sure.
So that gets rid of, takes care of people at home. And then once you're there, I think you can actually power a completely virtual workflow within the emergency department itself with, centralized labor resources that can be, optimized across different sites.
We're talking to Aiden Feng. He is a physician executive. Today's Kevin MD article is Rising ER Wait Times Signal Larger Health System Challenges. Aiden, let's end with some take home messages that you want to leave with the Kevin MD audience.
Yeah, I think there are two points that we should take home, right? One is technology is current not leveraged correctly in healthcare today, right? With the implementation of technology, we should be seeing productivity growth, capacity expansion, experience improvement. And I think at the core of that is we have been burdened with disjointed experiences from way too many digital health point solutions. But it also has tremendous potential, as we know and see in other industries. If we are able to weave together one platform above that one experience layer above the source of truth and the records in the emergency in the EMR, we can actually curate and create personalized journeys and experiences for both patients and providers. And at the same time, we need to take approach of, deploying technology with a patient first, provider first approach, not a technology first approach, right? To ensure that they actually create efficiency and help with workflows instead of creating additional complexity. And the second take-home point, I think, is as we think about the future and how we apply, the latest AI technologies, we really need to, again, take a patient first and quality first approach in terms of doing it safely, responsibly, right? So I think for lack of a better word, it's a hybrid AI approach where if it's, an administrative question, yes, we can apply LLM models and, deploy, the latest technologies. But if it's comes to clinical care, we should be careful and, make sure that it's grounded in evidence-based medicine and the latest guidelines and hopefully, at least for now, driven by deterministic decision trees and so on. And, if so at the end of the day, to combine those 2 points, it's really about putting patients and putting care first. And when you do that, you can also create downstream operational efficiencies and a capacity expansion. Yeah, thanks for having me. It's been great speaking with you today.
Aiden, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Yeah, thanks so much.